Hey everyone, it's good to be with you again. Today we are talking about trigger points, neck muscles, and headaches. Here's a side profile of the SCM, which stands for Sternocleidomastoid because it's connected to the sternum, the clavicle, or your collarbone, and the mastoid process up here in your jaw area. I wanted to give you an overall picture of the vertebra. This is a top view. So this area is called a foramen. It's actual hole, so your spinal cord can go down through there and be protected. This would be your spinous process. So that's what you would feel as your backbone. These are your transverse processes. So these are where a lot of your neck muscles will attach to. And this is the body of it. Again, here's a side profile of your bones here, just so you can see where your scapula or your shoulder blade comes down, attaches to your collarbone that wraps around to the front, and then these are some of your ribs, your cervical vertebrae, and your head. This is your levator scapula. I remember it like an elevator. It starts at the top. It goes from here to C1 to C4, joins up, and comes to the top of your shoulder blade. So you can see when this gets tight, it will pull the shoulder blade up. It can pull the neck back and to that side, whatever scapula, levator scapula you're talking about. This is a view from the back. So you can see your shoulder blade here has a portion that comes out over the top of your shoulder and articulates with the collarbone that stretches back in front of your body. These are very exciting and kind of complex muscles. We talk about these quite a bit in sessions. These are your scalenes. Now I've drawn all three sets on either side, but all three are on both sides. So these would be your anterior scalenes. That means they are the most front, they're closest to the front. They connect up here to the transverse processes that we talked about, 2 through 6, and they come down to your first rib. They help you rotate your neck, pull your neck down. These are your middle scalenes, so they're pretty lateral on the side. Connect from your second to your 7th cervical transverse processes. Help pull your neck down to the side, turn a little bit. And these are your posterior scalenes. So they would be on the back side of these middle scalenes here. And they're just short down to your second rib. And they would also help pull your neck just a little bit posterior, tilt your head back. Now, kind of a fun way to remember C1 and C2 as the atlas and axis is to remember a globe from grade school, and you have the atlas, which is the world part, and you have the axis, which is what the world is turning on. So here is the same with C1, your first vertebra. It's like the world, and it's turning on the axis, which is C2. Your upper traps can cause some problems. If you take your hand, reach across and grab right in here, that's pretty much your upper trap. From here to there and down to your collarbone. It wraps over your shoulder there. So it's just good to start out right here by grabbing gently and squeezing. You can do that on either side. Helps the fascia open up, start to warm up, and allow those muscles to slide underneath it. Spread up the back. You can press toward the spinous processes. For the SCM that we talked about and I showed you, you can see right in front. It's pretty prominent on me because it goes from the sternum, the clavicle, and up to the mastoid process. You can see when you rotate, it comes out and tightens. This muscle actually helps you rotate to the opposite side. That's why it protrudes, because it's tightening right here. So it will rotate and pull you down. When we get in the SCM, again, this one right here, you can use broad pressure, use the side of your finger, use the pad of your thumb. And this can feel a little invasive because you're getting to the front of your neck, but you are not grabbing your windpipe, okay? You want to make sure that you're not going too deep in here. If you feel dizzy at all, stop. But we'll grab in that SCM and just gently squeeze and knead. This is called milking the SCM. I'll show you a couple muscles we did not look over in the anatomy section. That would be the temporalis, and deep in here you have the pterygoid. Sometimes I work on this with gloves on inside the mouth. You can certainly do that. You can kind of get to it from the outside as well. You have the masseter right over it, so if you go from the outside, you could work potentially both at once. If you feel right in here with 1 or 2 fingers, it will be bony, and kind of slip into a dip there. You slide down a little bit towards your lower jaw and press until it's a little uncomfortable. I can tell the right side is tighter. Slowly open and close while you have the pressure in there. This way, and slide to the right and to the left. That will activate this muscle. The temporalis will also be stretched by clenching and opening. Slide forward and back. While you're doing those movements, you can press in your temple area with 2 or 3 fingers and slide down and forward. Go in some circular motions, being careful not to get too pokey. You want to again use those finger pads in there. At the base of your occipital bone, you have short little muscles that attach to your spine, and they are called your suboccipitals. It's really good if you have a headache. You can press in there and do some circular motions. So to see the scalenes that we talked about in actual anatomy, they would be in this area, anterior, medial, or lateral, and posterior, coming down under your clavicle here to the 1st and 2nd ribs. Now, a good way to practice in finding some of the muscles and where to push for trigger points, you can slide your fingers along your neck, along the muscles, and you'll start to feel these individual muscle strands, or the individual scalenes, SCM, and your fingers can feel like they slide off of it. Now, a lot of times the trigger points and most effective places to push will not be directly in what we call the muscle belly, but they can be on the side where it feels a little bit tighter. And trigger points are actually calcifications, so sometimes it'll feel like a little hard bean in there, grain of rice, can feel kind of tight. When you hook that, you can also bend your neck, so you're actually stretching that muscle, engaging it. You can bring it back, so you're slack, put slack in that muscle, all the while keeping that little bit of pressure right on that pinpoint spot. And that is a trigger point. So working in some of those trigger points in the neck, like I just showed you, would look something like this. Take a nice deep breath and allow your fingers to sink in before you start working. Hook on the edge of this muscle. Feels tender. Hold that pressure. Pressing up, pressing a little forward. And I'll turn. I'll look up and down. And then I'll let my fingers move so I'm not in one spot too long. Slide up to another sore spot. And all the way down, keeping pressure on. Then you can start over, find another spot. A lot of trigger points, tender spots will be somewhere in the middle here. A lot of times your levator scapula will feel crunchy in there. Gently put your fingers right on the top of your shoulder blade and do some shoulder circles to find where the corner of that shoulder blade is bumping into your fingers. Then you can start to differentiate between your actual scapula and just the calcification buildup in the muscle that's been happening. You want to put your fingers right there, not on the scapula, but right up against it, and press. And then do some gentle shoulder shrugs. If you have someone who is able to do this on you, they will be able to get a little bit more pressure, either while you're seated. They can put their elbow gently in that spot, and that may help alleviate while you're gently doing those shoulder shrugs. Thanks again for tuning in. I hope some of this information was helpful on headaches and trigger points and neck muscles. Make sure as you're doing these techniques that you're paying attention to your own body, and if something is making you feel dizzy, just come back out, take a deep breath. You want to make sure to take deep breaths as you're putting pressure on. Let that breath out and sink in slowly until you find that area of discomfort. Also remember, trigger points can be very tender. They can refer pain, so you might be pressing here and you'll feel it tingle in your finger. That's very normal. Referred pain does not normally last more than 2 to 20 seconds, okay? So it's just because everything in your body is connected and affecting each other. So make sure that you're looking out for that, and it's okay if it's a little bit intense for a few seconds. That's what it's going to take sometimes to help release it, because some of this tension didn't just snap and it's there all of a sudden. Maybe you felt it suddenly one day, but it's been building up for a while. So you have to remember to be patient with yourself as you're working through this. You might try this technique one day, do some stretches the next, and then try it again later in the week to help you, again, start to undo or unravel that tension that's been there a long time. Remember here that none of this information or these techniques are meant to treat or diagnose. I don't claim to do that here, but this is available for your home care and your education. So I've had a lot of fun putting this together, and I hope to see you soon. You guys take care.